end, I hope. So, again, as I said, today's speaker is Dr. David Sparkman from the Department of Psychology. David received his bachelor's degree in psychology and history from Eastern Michigan University and received his PhD in experimental psychology from the University of Arkansas. David is in his third year as an assistant professor of psychology on campus here and regularly teaches courses on introduction to psychology, social psychology, and the psychology of race and social class. In his research, David runs the Diversity, Prejudice, and Intergroup Relations Lab, which examines different ways to mitigate intergroup bias and capitalize on the benefits of racial, ethnic, and cultural diversity. David has presented his research at national and international conferences and has published in peer-reviewed journals on topics such as multicultural experiences, ideologies about diversity, political attitudes and behavior, empathy and perspective taking, personality, and broad social identities like identification with all humanity, which of course is the topic of today's presentation. So thank you, David. The platform is all yours.
Great. Thank you, Catherine. I'm going to share my screen here. And everybody can see this? Hopefully. Is this visible? Okay. I guess no sound is good news, so I'll just continue. All right, so I'm David, like Catherine mentioned. The title of my talk today is Identification with Humanity in COVID-19, taking a social identity approach to health-related behaviors during a global pandemic. So just as an overview of what we're going to talk about in this presentation, I'll give a background on what social identities are, why are social identities connected to health, and which social identities are most relevant for a global pandemic, and what is identification with all humanity correlated with, and how is it structured. Then I'll go over a research study with all of you, including my hypotheses, some information about the participants in the study, the measures I used, and the results. And then I'll finish with some summary, take-home points, implications, and future directions. So I remember when the pandemic kind of first started, and in particular when the WHO declared the coronavirus a global pandemic. There was a New York Times opinion piece by Scott Kelly, who was an astronaut, giving some tips about how all human beings could get through this isolation that we all experienced in early March. And one quote from the opinion piece that really stuck with me was where he said, "Seen from space, the Earth has no borders. The spread of the coronavirus is showing us that what we share is much more powerful than what keeps us apart. All people are inescapably interconnected, and the more we can come together to solve our problems, the better off we will all be." And so this seemed kind of like maybe a remedy or an antidote to the coronavirus, and how being more connected with one another can potentially solve this problem. I also remember the kind of daily morning briefings that Governor Andrew Cuomo gave, specifically in New York State, and he made similar connections, but went a step further than just saying that it's what makes us connected to one another in general. He said that our closeness makes us vulnerable to the virus, referring to New York and New York City in particular, and why its confirmed cases were so high. But it's true, he says, that your greatest weakness is also your greatest strength. And our closeness is what makes us who we are. It's what makes us feel so connected one to another. It's what makes us so accepting of one another. And it is this closeness that makes us the human beings that we are. So Governor Andrew Cuomo mentions a specific type of connection from across all human beings on Earth And this was really interesting to me because it seemed like we kept getting this reference to connection to human beings, to all human beings, when this pandemic first started. So thinking about that, you kind of have to take a step back and talk about the social identity approach to human behavior, which essentially argues that the core of our experience as human beings is feeling connected to and sharing membership in social groups with other people. So the gender that we identify as, our racial identity, whether we identify as a member of a certain country, these are all referred to as social identities. But part of this theory as well is that these identities are not singular, but they kind of exist at different levels of abstraction, where at the individual level, we see ourselves as a unique individual person. I see myself as David, who has these traits and experiences and characteristics, and how I'm different from other unique individuals. But as you kind of move up this pyramid here, those identities get more abstract to the point where our social identities are seeing ourselves as a member of a group and how we're different from other outgroup members. And the most inclusive identity is this human identity. The long story short here is that whatever identity you're focused on in the moment has a lot to do with personal factors and maybe the situation that you might be in. But the important thing here is that this human identity is the most inclusive social identity that we have, whereby all human beings are part of the same in-group, the same human family. So when you're identifying at this human level, it means it doesn't really matter what gender you identify as, or your race, or your nationality, or your religion. You have one big in-group that encompasses all of these other intersecting identities because you're all part of the same human in-group. Increasingly, more research has looked at the role of social identities in health behaviors, that whether we're healthy or unhealthy isn't necessarily purely about physical health or maybe genetic predispositions. It has a lot to do with the social identities that we have as well. In the most simple way, people who identify with social groups, these social groups can serve as a basis of social support and coping. And when you have a social support network, a group that you identify with, it can promote better physical and mental health, and it can also buffer against stressors that we might experience that might lead to negative impacts on our health. Individuals also see themselves as examples or exemplars of their social group, and we often look to our social in-groups to see what behavior is considered normative. And if whatever those normative behaviors are, the most likely behaviors and the most common ones, we're also likely to adopt those because we see ourselves as a member of that group. So it has implications for whether we take up smoking, or we use substances, or we engage in certain types of sexual activity. Your identification with social groups also might promote or be related to feelings of care and concern for how other in-group members are doing. And in particular, when the collective in-group is in danger or in trouble, it should kind of recruit behaviors that help protect that in-group. The COVID-19 pandemic is a unique situation here because pandemics necessarily cut across national and cultural borders. So it doesn't really matter that much if you're living in the United States or living in Australia or living in Malaysia. The main idea here is that this virus is spreading across the globe, and nearly all human beings have been affected. To date, over 35 million human beings have been infected, and over 1 million have died from COVID-19. And so there should be potentially this global mobilization of health behaviors that might serve to protect all members of the human in-group from contracting COVID-19. So what does some of the research say so far about who is a person who identifies with all humanity, and what are some correlates to that? We know that people who strongly identify with all humanity tend to be less ethnocentric, so they tend to put less emphasis on their own ethnicity or their own culture, and do not necessarily say that theirs is better than others. They tend to be more empathic. They tend to be higher in the personality trait of openness to experience. They tend to have more multicultural experiences, so more interactions with people from different cultures. They tend to be more concerned about human rights across the world and knowledgeable about issues that are going on. They're more likely to contribute time and resources to humanitarian efforts and contribute money to international charities. And specifically related to pandemics, research has shown that people who are who identify with all humanity are more concerned about and willing to combat pandemics in the past, like SARS and the avian flu and the Ebola outbreak several years ago. Some research has also looked at how identification with all humanity is structured, or what makes up identification with all humanity. And it is a kind of a broader concept that's made up of two subparts that are still correlated or related to one another, but you can still kind of split them up and separate them. One has been called this bond factor, and the other has been called a concern factor. And this is from some research that my colleagues have been doing recently. Bond with all humanity, to me, is more of the identity piece, which is categorizing yourself as a member of the human in-group and others as a member of the in-group, human in-group, feeling connected to those people, feeling close to those people. This is what makes up a bond with all humanity. Concern for all humanity is more about behaviors and orientations to want to help the human in-group, and also feelings of care and responsibility, that it's almost your obligation to do something to protect the human in-group. So this is what identification with all humanity is made up of, you could say. So some hypotheses that I have is, in general, I think identification with all humanity will be positively related to some behaviors that help reduce the risk of transmitting COVID-19, or also just in general reduce the risk of harming others. So I think that the stronger your identification with all humanity, the more likely you're going to socially distance, the more likely you're going to wear masks, the more likely you're going to want to influence or try to influence others to also engage in some of these health-related behaviors. And finally, it might be related to the extent to which you overbuy or you hoard scarce products. This isn't as much of a problem now, but when the pandemic first started, people were going to the grocery stores and buying food for 3 weeks, maybe more than they needed, buying up all the disinfectant wipes that they could find or the masks that they could find, to the point where healthcare providers didn't have what they needed. But I think that while bond with and concern for all humanity will both be positively associated with these behaviors, I think concern for all humanity is going to be a little bit more strongly associated with them than bond, because the concern factor is a little bit more behavioral oriented. And importantly, I think that these relationships between bond and concern for all humanity will be unique or independent of other variables that might also be related to health-related behaviors. So the main goal here is to try to predict or explain some of these health-related behaviors during COVID-19, and I'm thinking that concern for all humanity and bond with all humanity will predict this. But there are also lots of other things that could be related to whether you socially influence or socially distance, so on and so forth, like demographics, your political orientation, the extent to which you wear a mask or socially distance has been related to whether you see yourself as more liberal or conservative, or more of a Republican or more of a Democrat, whether you have concern for others in general, the extent to which you're scared about germs, the extent to which you have the big five personality trait of neuroticism. These people tend to be very worry-focused and have kind of an exaggerated response to threats. and also just in general your perceived risk of being infected by different infectious diseases. And then finally, identifying with a more local community or identifying with a country in general. So all of these things could also be related to these health-related behaviors, but what I want to do is I want to try to control for those and remove those and see if there's anything left for concern for all humanity and bond with all humanity to predict these health-related behaviors. So I had recruited a sample of American adults from a website called Prolific for $1.76 each. There were 335 participants in the sample, 49% of whom were female, and there was a nice age range from 18 to 17 years old. The average age was 32 years old. These next couple of slides are going to be probably a little overwhelming, but just to give you a flavor for the measures that I use to measure these variables, and also the response scale, and the average response for each of these measures and the reliability. But just to give you a flavor of what some of these items on these scales sounded like, concern for all humanity would ask how much do you believe in being loyal to all of humankind, bond with all humanity, how close do you feel to humans all over the world, identification with community, how close do you feel to people in your community, and identification with country, for example, how close do you feel to Americans. Then some of these other variables, control variables, you could say, what's your political orientation, very liberal or very conservative, how much empathy do you have, do you see yourself as somebody who worries a lot, which is an item in the neuroticism scale, and then measures of disgust sensitivity and perceived vulnerability to infection. I'm going to get through these here just to save some time. And then finally, the primary outcome measures, behavioral outcome measures, social influence, how often do you have conversations with others about ways to minimize the spread of COVID-19? How much do you try to stay 6 or more feet apart when around other people for social distancing? For mask wearing in general, how often do you wear a mask to minimize the spread of COVID-19? And also overbuying. So specifically in the last 4 months, how much has COVID-19 caused you to overbuy scarce personal protective products like face masks and gloves? So here I'm going to go over the results with these 4 primary health-related behaviors one at a time. These are all the variables that were included in the model. And what we're paying most attention to here is concern for all humanity and bond with all humanity at the bottom. These numbers are standardized betas or regression weights. And essentially, this just means that you can compare these numbers to one another. The numbers that are bolded indicate that there is a significant and unique relationship between that variable and social influence. And the value here indicates how strong that relationship is, and the sign gives you information about the direction, how those 2 variables move with one another. So what this suggests in general is that the older people are, the less likely they are to socially influence others, and this is a significant and unique relationship. Or on the flip side, the younger you are, the more likely you are to want to try to influence others. What we see here, importantly, is that bond with all humanity is a unique and positive predictor of social influence. So the more you see yourself as connected to other human beings, the more you try to socially influence them. But concern for all humanity was not a significant predictor here. Another way you can look at these results is trying to see how much are we learning about social influence based on all of these variables, and of all the things that we would need to understand whether somebody socially influences others or not, we only are learning about 34% of that total. And identification with all humanity gives us a little bit more, so we understand whether people socially influence by adding these two variables. Looking at social distancing, again, the same setup here with the standardized betas on the right, paying attention to concern for all humanity and bond with all humanity. Here, concern for all humanity is positively related to social distancing, but not bond with all humanity. So the more you're concerned and care about and want to protect other human beings, the more likely you are to social distance. We don't understand as much based on these variables about why or when somebody socially distances or not, but we do understand that a little bit more. We're explaining 18% of the variance now when we add identification with all humanity. Now looking at mask wearing. Here are the results again. The numbers that are in red are not quite significant at a conventional p-value level, but they're sometimes called marginally significant. And what we see here for concern for and bond with all humanity, bond with all humanity is marginally significant predictor of mask wearing, but this is the weakest association we've seen so far. According to all of these variables, we can understand about 17%, which isn't very much at all, of the variance of why people wear a mask. And we learn a little bit more, 1% more, when we add the extent to which people identify with all humanity to the bucket here. Finally, when you look at overbuying, concern for all humanity is the only significant unique predictor for whether you overbuy, and this is a negative relationship. So the more you are concerned for other human beings, the less likely you are to hoard scarce products, but bond with all humanity is not a significant predictor here. We understand 29% of why people overbuy with these variables, and we understand a little bit more, we can explain a little bit more when we add identification with all humanity to the bucket. So now summarizing these findings and then kind of what they mean. Overall, identification with humanity seems to be important and a unique predictor of these health-related behaviors during COVID-19. And at least conceptually, concern for and bond with all humanity should have unique roles for predicting specific outcomes. Concern for all humanity is more focused on behaviors to protect humanity, and bond is more focused on attitudes toward or identification with all humanity. But there wasn't really any clear pattern for when concern or bond predicted these behavioral outcomes. Bond with all humanity predicted social influence and mask wearing, but concern for all humanity did not. And then concern for all humanity predicted social distancing and less hoarding of products, but bond with all humanity did not predict these things. I'm not entirely sure why that is the case. But together, what these results suggest is that feeling a bond with and having concern for the human in-group are helpful in recruiting some behaviors that might reduce the risk of transmitting COVID-19 and just reduce harm to fellow human in-groups. But we really have to be careful not to conclude that identification with all humanity here is causing or driving these health-related behaviors. This is a correlational research design, so we can only look at how these things are associated with one another. And in order to understand whether identification with all humanity causes these health-related behaviors, we'd have to do an experiment where identification with all humanity is manipulated or activated in one condition for some participants and not activated in another condition for other participants to see if human identity causes health-related behaviors. And this is a study that I'm currently talking with two students I'm working with, Haley and Emerson, and our goal for the semester is to try to do an experiment where we manipulate identification with all humanity. This is a little daunting because very few studies have successfully done this. By that I mean successfully activated or manipulated identification with all humanity. So we're trailblazing a little bit here. All right. I want to thank everybody for coming, and it looks like there's at least 10 minutes left for questions, which is a little bit less than I hoped for, but just some shameless plugs here. I'm a member of the Identification with All Humanity Lab, which is a group of researchers across the world, across different countries, that look at identification with all humanity, and also the principal researcher in the Dipper lab in the department, which is what I call it. Okay, so I'm going to stop sharing now. And what questions do people have, if any?
Yeah, thank you, David, for a fascinating talk on a fascinating subject. So as a reminder, folks can directly ask a question of David if you, if you unmute yourself and I guess raise your hand, or you can type your question directly into the chat box, and I will monitor that and relay your message to David. I think April has a question.
I think I have a question. David, I think this is so fascinating. And I know I can probably track you down. So if you don't want to spend time chatting about this, we can chat about it at length another time. But I really am curious about thinking about the results related to bonding or identification with America. Because I saw some of those, predicting some of those coefficients were strong. Or looked like they were strong. And I was thinking about how at some level we think of, feeling bonded with America as nationalism. On the other hand, there's this idea that we're all Americans. And so there's that step from the social identity groups of race and gender and orientation and what have you to the we're all Americans. And then there's that other level of all humanity, like all international. And I'm wondering if is that part of what's going on with the America, or is the bonding with America nationalism per se, as opposed to, do you know what I'm trying to ask?
I think so. I mean, it's curious. It's curious to me because you would think that identifying with other Americans would also help recruit some of these behaviors as well, because we're all Americans and we want to try to keep all other Americans safe. But some of the interesting thing was, I don't remember exactly, but there were some negative correlations. Like the more you identified with America, the less likely you were to socially distance, I think. The more likely you were to overbuy, if I'm remembering correctly. And I'm not really sure why that's the case, but I wonder if part of identifying with America and other Americans is identifying with the values of America, which is strong independence and individualism, which is more like I identify with America to such an extent that I identify as an individual who's going to do what I want to do and not really care as much about what other people are going to do. So that's interesting. I don't know if that answers your question, but that's the way that I think of it.
Yes, that's helpful. Okay.
Yeah.
Thank you.
Mm-hmm. But yeah, we can talk more about it later, I'm sure.
Anybody else? Actually, David, I don't know if this is the right place to ask you, but you brought up, ongoing / future research on manipulating the identification with all humanity. I'm actually very curious about that, partly related to, in fact, my own perhaps ignorance on how this identity is formed. I mean, it seems to be such a abstract concept with so many different layers. Is it something, you build up layer upon layer, or is it more of a, amorphous process? Yeah. Do you have thoughts for us?
Yeah, that's a great question, and it seems to be the one that myself and a lot of my other colleagues who are researching identification with all humanity are looking at now. We know what it's correlated with. We know a lot of the time it's seen as a kind of a personality trait that some people just have identification with all humanity and others don't. And there's a lot of research looking into why or where it comes from, how does it develop, and I think that we still can't say for sure because we haven't done any of these kind of experimental cause and effect studies, which is really critical to learning that. But one of the things that I've looked at in my research is looking at how identification with all humanity might come from just interacting with a lot of different humans across different cultures. And when you kind of study abroad and interact with people and travel to different countries, you kind of recognize that there are other human beings on the planet. And while you might speak different languages and eat different food, you all speak a language to one another, and you all eat food, and you all have to, do these basic things, and we all have basic norms, and we all have really similar things that make us connected as human beings. And I think one of the ways that identification with all humanity develops is by having these multicultural experiences. That's what I've looked at and researched a lot. I'm trying to think of some of the other work that my colleagues have done so that I am not being overwhelmingly selfish about my own perspective. But I can't think of anything right now.
I think we have a question from Mel, I believe.
Yes. Just follow up on what April was talking about and potentially the way the identification with America may be interpreted. Is this survey being used in other countries, especially in other countries where collectively maybe people are more communal? I remember a long time ago reading an editorial in a Canadian weekly that described the watchword of America as life, liberty, and the pursuit of happiness, this very individualistic approach. And the Canadian equivalent was peace, security, and good government, a very communal approach.
Yeah.
So is this survey being used internationally so that maybe what April was talking about a little bit there might be teased out?
Yeah, that's a great question. I know that I have a colleague in Poland who did some research once the pandemic started with a Polish sample because she's Polish. Her name's Kasia, and I love working with her. She's really great. And Poland is part of Eastern Europe, and it's more of a collectivist country when you compare it to Western Europe. And I can't remember what she found, and I'm not sure if she shared with me, but back when the pandemic started, she was like, I'm so excited to do this study to see if see if the pandemic is changing the extent to which Poles identify with all humanity. Is it increasing it after the pandemic or decreasing it after the pandemic? And I don't remember what she found. But to answer your question, yes, some research has looked at this in other cultures that are less individualistic than the U.S., but not much yet. I think that's important to look at because I think this distinction between kind of individualism and collectivism might be important.
Thanks.
At least at the level of identifying with the country.
Appreciate it. Thank you.
Yeah, thanks, Mel. April, is that a physical hand?
That's me. That's my physical hand. Hi again. Cool. So I know this. I just think this is so interesting, and I'm thankful that Mel built on this because okay. Remember when the pandemic hit, and I feel like we all went into our classrooms and were like, you know what, you guys, this is an opportunity for America to come together. Like, we have to work on solving this problem together. And then, like, within a couple of months, it felt like things fell apart. And granted, there were various events occurring that were relevant, but I'm just really struggling to understand this perception of common humanity as we're common Americans, versus common humanity as everybody's human around the world.